Preserving the Future, Supporting Transition into the Workforce for New Nurses. Hello, my name is Brandy Lawrence, and I've been a registered nurse since 2002. I hold a Master's of Science in Nursing from Excelsior College and a Bachelor of Science in Creative Writing from USC. Throughout my career, I have focused on helping nurses achieve their full potential. I began by creating programs to help nurses transition into practice and to increase the number of nurses in my facility with advanced degrees. I'm a strong opponent of lateral violence, and I've worked hard throughout my career to create a sense of teamwork and safety among nurses. My current project is a free online course, Transitioning from Student to Professional Nurse. An online platform makes the course available to every nurse without regard to geographic location or time constraints. Moodle is a free online learning platform designed for educators. It is easy to create and it is easy to use. One of the greatest benefits to Moodle is the translator, which allows students to access content in their own language. Moodle can support up to 1 million users and can be accessed from any device worldwide. Therefore, I believe it is an excellent platform to educate nurses. Nursing is a challenging profession that requires a strong knowledge base and confidence. The first year of nursing is often described as an anxiety-filled roller coaster with good times and harrowing experiences. Due to this, up to 43% of nurses leave the profession within the first few years. The loss of these nurses reduces our workforce, diminishes the numbers of nurses with advanced degrees, and it increases the cost of healthcare. A reduced workforce is directly related to decreased safety, increased medical errors, and higher mortality rates. The cost of replacing nurses is expensive. One hospital can pay up to $6.4 million every year to replace nurses. These costs are pushed off to patients, the community, and society, as 44% of healthcare is paid for by the government. The cost to the nursing profession is even more devastating. Failure to retain new nurses means fewer nurses with advanced degrees. In 2014, almost 80,000 students were turned away due to lack of faculty. The nursing profession also loses what possible advances and contributions these nurses would have had to the profession. There's substantial evidence that sometimes called new graduate programs greatly impact nurse retention. These programs often offer an orientation and some sort of formal or informal preceptorship. However, short programs, inadequate mentors, and overworked staff can reduce the effectiveness of these programs. My course hopes to fill the gap when traditional transition methods fail. Dunphy Porter Thomas's Circle of Caring was used as a philosophical context for this project. The attributes in the Circle of Caring model are the values that are at the core of the nursing profession. Authentic presence, or an awareness and knowledge of self, knowledge, courage, patience, advocacy, and commitment. This course hopes to link authentic presence with a commitment to caring that directs obligations in lateral violence situations and encourages patience and commitment in learning development from novice to expert. The course uses an affective domain framework that focuses on a learner's internalizing a value and using it to make future decisions. The theory suggests that as a learner becomes aware or receives values and attitudes in nursing practice, they will respond and act correctly when given a choice. 3 factors that impact the ability of a nurse to transition successfully include workplace environment, ability to set realistic expectations, and the capacity to adapt to heavy workloads. Participants of this course will understand the 5 stages of nursing skill development according to Patricia Benner's novice to expert model, recognize realistic goals and expectations for a personal skill level, manage patient information and workloads by creating personalized flow sheets, and identify the forms, effects, and solutions to lateral violence. Course grading is based on a written paragraph, creation of a patient flow sheet, and 1 quiz. A post-course survey is given to participants to evaluate course content, design, and the technology used. A pilot study was completed using a variety of skilled nurses from expert educator to newly graduated nurse. Recommendations and changes made by the study include a discussion platform added to the lateral violence topic for students to discuss, share, and support each other on topics related to lateral violence. A collaboration platform is added to the patient flow sheet topic for students to share, save, and print each other's work. And a communication section is currently underway to address professional communication and the multidisciplinary team. As a nurse educator, I believe it is my duty to be the voice of change both within my healthcare facility and without. This project demonstrates alternative methods for educating nurses using technology, introduces the Moodle platform to educators, and can be used to assist new nurses transition successfully into the workforce. This project represents the knowledge I've gained throughout my studies, and if it helps even one nurse, I consider it a success. For each nurse lost is not only an educator or researcher lost, it is a mentor, motivator, colleague, and friend lost as well.